Hi, my name is Dr. Chad Watkins with Watkins Foot and Ankle Clinic in Leesburg, Florida. And today I wanted to talk a little bit about neuropathy. So what neuropathy is it's basically where the nerves have been damaged due to a systemic condition. The most common conditions affecting the nerves are diabetes, thyroid, anemia, and alcohol. So what I tell people is basically if your diabetes is under control, then the neuropathy shouldn't be getting worse. If your thyroid is under control, then you shouldn't be seeing it progress. And if you're on B12 vitamins or receiving B12 shots, it should be under control as well. But if you see the condition getting worse, sometimes you have to think, hey, there may be another condition causing it, and that it could be stacked on top of each other. Now, often people will have problems, and it won't be any of the most common causes. Causes of neuropathy range from things like syphilis, leprosy, AIDS, heavy metal poisoning. So I tell people if you live out in the country and you have a well, certainly you may have arsenic poisoning or something of that nature, and you need to have the well checked. If you lived in an old house, you may have a lead poisoning. It could be a lead-based paint, or you basically could have lead-lined pipes that are causing you to develop lead poisoning. So I tell people there are environmental factors that can cause it. There are hereditary factors that can cause neuropathy. So if your brother, your sister, your mom, your uncle all have the same condition and are suffering from the same symptoms, you may have a hereditary neuropathy which is present. So often what we do in order to diagnose the neuropathy is we send you out to a physician called a physiatrist or your neurologist, and they'll do a test where they stick you with pins and needles. It's called a nerve conduction / EMG study. EMG is just electromyography. And essentially what they're doing is they're sticking you with a needle up in the upper part of your leg and sticking a needle in the lower part, and they shoot electricity and they measure how quickly the signal is transmitted down the nerves. And so if it's delayed, basically they can tell, yes, indeed, there is damage to the nerves. Now, the other thing that test can do is it can tell the difference between what we call a neuropathy, which is the nerves being damaged due to a systemic condition, and a radiculopathy. So with radiculopathy, basically that's a pinched nerve in your back. So often your back basically will narrow and you'll get spurring, or you'll have a bulging disc, and it will pinch on the nerve and it'll cause a radiating, burning, shooting, stinging down your leg, very similar to like a sciatic pain or sciatica. And so what I tell people is by doing the test, you can tell whether there is the neuropathy or the radiculopathy, because often people will think that their diabetes is under control and they won't have thyroid problems, they won't have B12 problems, but the neuropathy continues to get worse. Well, you can have a back problem stacked on top of the nerve problem. So often when I send people for tests, it'll show, hey, there are two problems present. So if you've ever had any type of low back pain or things like that, basically it could be causing the symptoms down in your feet with burning, tingling, stinging, electrical sensations. With a neuropathy, often people will say that their feet feel puffy or swollen, or that it feels like it's in a vice grip. I had one person that related that it felt like they had stuck their foot in mud, pulled it out, and that it had dried and was encased in something. So I tell people these strange sensations are caused by the nerves being damaged. But the most important thing is to check and to protect your feet. So you want to check your feet every day for any type of cuts, sores, scrapes, wear protective shoe gear, and then basically come in, we'll send you out for the test, we'll get it diagnosed, we'll determine what's going on, and then often we'll send you out to the neurologist and they'll play the detective and try to actually find the cause. Because just finding that the neuropathy is there does not tell you what the cause of the neuropathy is. You need to figure out what's causing it in order to prevent it, because if you don't stop it, it'll continue to damage the nerves and it'll progress. So often with a neuropathy, it'll progress in what we call a stocking glove distribution. It'll start at the toes and it'll work its way up the leg, or it'll start at the fingertips and work its way up the arm. And so I tell people, yes, when you start feeling it in the toes, if it's starting to work its way up the leg in that stocking glove distribution, you want to get in, you want to be seen, and you want to find out what's causing it so that you can stop it. If it's as simple as needing a B12 shot, you just go in and get a B12 shot once a month, and that will control it. Or maybe your thyroid medicine is out of control because you had your thyroid removed when you were younger. Or your diabetes is out of control and you just need to be able to see a endocrinologist. Now, sometimes I tell people when you go to the neurologist, they're going to run all these tests and they won't be able to figure it out, and they're going to kind of throw their hands up in the air and they're just going to label it an idiopathic neuropathy. And there you can think of it as, well, the idiot just can't figure out what's going wrong with me. So it's called an idiopathic neuropathy. It doesn't mean that there isn't something there. The test has shown that there is the damage. It just means we can't figure out what's causing the damage yet. And sometimes it'll take a couple years for the diabetes to show up or for the thyroid to show up. So if you're having any foot or ankle problems, you think that you may have a neuropathy, you have numbness, burning, tingling down in your legs, come in to see us at Watkins Foot and Ankle Clinic in Leesburg, Florida, 352-805-4317.